prostate disease usually can affect the males of all ages, teenagers, middle age, and elderly. What are the common symptoms of the prostate disease? It depends upon the age of the patient. In youngsters, usually the prostate can develop the infection and lead to prostatitis symptoms. And middle age and elderly, the prostate symptom can be due to two diseases. One is BPH or benign prostatic hyperplasia or prostate cancer. We should be very vigilant because the symptoms of all these problems are almost similar. So let's say, what are the common symptoms the prostate disease can have? If there is infection, as in prostatitis, definitely there will be pain while passing urine. That is called dysuria. There may be, in some cases, hematuria. Some cases, there will be fever, rigor, chills. So all these things points to infection. That majority times can be treated with the medications. Other problems in the middle age and elderly, commonly we see the patient will be coming to the OPD with a voiding difficulty. That will be what are the symptoms we will see in detail. One is they may have to go and wait for some time. That is called urinary hesitancy. Urine will not come. If it all comes, the stream will be less. While passing urine, there may be intermittency. That means while passing the urine, it will stop in between. There will be sense of incomplete voiding. They may have to wake up at night multiple times and with a disturbed sleep. In some cases, there may be blood in the urine called hematuria. So these are the common symptoms which the prostate disease can present. What are the investigations which we can do? We are having a prostate hospital, and with single visit of one day disease, the diagnosis can be made. Let me see how. I will tell you. One of the common investigations which we do is the history. We have to do the rectal examination and palpate the prostate, so we will understand what is the nature of the disease. Laboratory investigations are urine routine examination, then common basic blood test. Along with that, we will do a specific test for the prostate, that is serum PSA. Okay, and advanced tests like prostatic health index also available. Okay, so that is a blood test which will give us a clue whether the prostate is benign or it is cancerous. Then comes the ultrasound examination, which will give the abdomen. Ultrasound will give clue to the prostate, kidneys, and the bladder part. And also it will tell that urine is completely emptied or not. Special scan is the transrectal ultrasound scan. It is done through the rectum and specifically see the prostate. Other OPD investigation is that we will ask the patient to do a uroflow test. What is uroflow test? It's just patient has to go and pass the urine in the machine. So it will detect the pattern. It will give a pattern and clue to the doctor what is the type of the disease, how much difficulty patient is having, everything it will give. The clue to the disease. Then comes the nowadays available, majority is having a flexible cystoscopy. It's an OPD procedure, it takes hardly 1 or 2 minutes. We can put the scope and see, inspect the urethra, bladder, prostate, and analyze at what is the stage of the prostate disease. Okay, and with this diseases investigation itself, we will be having a clue whether it is benign or malignant. If the PSA is raised and clinically when the prostate is hard, the special investigations like MRI scan of the prostate or gallium scan, PSMA scan of the prostate can be done. So the diagnosis is confirmed. Now we will talk about the treatment part, medication part for the benign prostatic disease. If the benign prostatic disease, majority of the things we have to, one important thing is the lifestyle modification is very important. Avoid heavy non-vegetarian diet, avoid spicy diet, avoid smoking, do regular exercise, and along with that, the medications like alpha blockers, lot of alpha blockers are there. Once added, the symptoms will get drastically improved. Unlike other diseases, these prostate medications will not be enough for 1 or 2 days. It requires a long term. Maybe patient may have to take around 6 months to 1 year. Okay, that is a medical part. Meanwhile, the patient should have a follow-up and flow rate, etc. If there is any problem, then we may have to go for the procedures. What are the procedures for prostate diseases? Now, latest advanced procedure at our center we are doing in indicated cases, Hall-up. Hall-up, what is Hall-up? Hall-up is holmium laser enucleation of the prostate. The benefits is that it requires 1 or 2 days admission. With the leakage, with the lasers technology, we can enucleate the large prostate, even 100 to 200 gram prostate, completely in single go and even without blood transfusion. And beauty of this is that the recurrence rate is less with this procedure, and important is that this can be done even on patients taking blood thinners, even if they are having any cardiac comorbidities, laser can be done safely. Then other modality is that another variant of laser which we are having is the thulium, that is thulium laser enucleation or ablation can be done. In some cases, we can do the bipolar TRP or monopolar TRP also. In the TRPs, we are not enucleating, we are scraping the glands, which can also be done. It is done in many centers of India successfully. Then comes the other minimally invasive methods where we have the prostate stents in highly comorbid conditions like a patient is very aged and cannot undergo any procedure. You can put a stent, prostate allium stent is there. Other definitive procedure for youngsters, sexually active people, we can do the urolift procedure which is highly safe and successful. There is some other new modalities like radiofrequency ablation, needle ablation, etc. is there. In some cases, there is indication for embolization of the prostate. The only indication for prostatic artery embolization is a bleeding prostate and patient is too sick. At that time, you can embolize and stop the bleeding as a temporary procedure, and once the patient is stable, you can go and enucleate the prostate. And I want to stress here, prostate artery embolization is not the primary modality of any intervention method for the prostate generally, because it is done as a temporary procedure. Once embolized, the glands will get slowly shrink and vascularity decrease. The same mechanism where the drugs also doing it. Okay, so the thing is that patient will have a temporary benefit, but it's not a permanent solution. Coming into the prostate cancer, suppose if the clinical suspicion by raised PSA comes and if the MRI or PSMA scan suspicion of prostate cancer, we can go and do the 12-core or 16-core prostate biopsy, needle biopsy. According to the biopsy report, we can decide the treatment for prostate cancer. First of all, I want to tell you, once the diagnosis of the prostate cancer comes, never get afraid, because in very low stage cancers, sometimes active surveillance is only needed. In other cases, we have the options, various options is there. One is radical prostatectomy. We are doing radical prostate in a very good number with the DEX robotic system, in which the prostate is removed completely and safely. And nothing to worry, the patient will have, in majority cases, urinary control and sexual control both. Postoperatively, initially transient urinary wetting may be there for maybe 2 to 3 weeks, and it will be settled with the medications. Other major modality for the prostate cancer treatment is that radiotherapy, androgen deprivation therapy, and in advanced cases, we may require the chemotherapy, etc. So whatever the thing, there are very advanced methods for dealing the prostate cancer, especially as a surgeon. In my center, we are doing radical prostatectomy in very good number, and it requires only 2 or 3 days admission with very minimal scar of 1 centimeter or 5 millimeter incisions. And only thing is that after the procedure, we keep the catheter for 1 week, for that patient can go home and come back for the removal of the catheter. After the definitive procedure, the patient is followed up with the PSA 3 monthly and gallium scan at the end of 1 year. So in some cases, patient may require adjuvant radiotherapy or androgen deprivation therapy. In nutshell, I can tell you, prostate cancer with the new modalities of the treatment, it has become almost like a OPD care, very much successfully, and patient leads a very normal, healthy, productive life. Thank you.